feel like we're having an ED conversation now. And I'd like to bring in the other folks because as interesting as this is, let's hear from you in terms of some of the other leadership topics you'd like to broach or concerns you have, or I guess a question going through my mind is, what's the future of leadership from your perspective? The younger people here at the table are now taking on and moving into these leadership roles. What do you see as your challenges? Well, I feel like we're having an ED conversation now. And I'd like to bring in the other folks because as interesting as this is, let's hear from you in terms of some of the other leadership topics you'd like to broach or concerns you have, or I guess a question going through my mind is, what's the future of leadership from your perspective? The younger people here at the table are now taking on and moving into these leadership roles. What do you see as your challenges? Service delivery and service management under the family health teams. I don't know if you could talk a little bit, because I think it's interesting to add this to the conversation.
Sure. Well, actually, because the family health teams are a cheaper way of organizing primary care, in that they have, so they've linked all the family physicians and they've organized them all into 5 teams, and within each team then they have pharmacists, mental health clinicians, nurse practitioners, some advanced practitioners. Social workers, they call them mental health clinicians. It's very similar to a community health center. And then there's a team administrator for each team who is, handles a lot of the higher level administration for that entire team. They all have team meetings within each discipline and the family physicians and share practices on, so that they all share electronic medical records. They're sharing the way they do things, how they're doing their clinic hours, trying to save appointments every day. And so that if one team is doing a particular thing or uses a study or a survey or a tool, then they share it with all of the other family physician teams and clinics. It's better for the patients, but it is a cheaper way to deliver.
Talk about the umbrella organization, which I think is kind of neat.
So so there is primary healthcare services is the administration of the family health teams. So they handle hiring all the allied health professionals and dealing with the funding from the Ministry of Health that is granted for the operations for all those 5 teams. So instead of each individual family health team, like in the rest of the province, each individual family health team deals with the Ministry of Health, has a separate agreement. They're all under one umbrella of 5.
And that's what represents those 85 doctors.
Yes.
I think it's a neat model, a way of delivering services. I don't know if we'd see something like that in social services, how that would work, but it's just that they've thought through. And if you know the history of family practice in Ontario, it's gone from trying one model after another model after another model, and the doctors didn't like it and they didn't agree to it and they fought. And this one seems to have gotten legs, and the family health team concept has done that. But what I like about it, and the work that I did with them, was this umbrella team that does all the hiring, and also recruits doctors.
Yes.
Is one of the other things. So you said they've gone to 2%. Well, that's a miracle in communities as well. So it's another way of delivering services. Thanks, Tammy.
And it's just one other thing too. The physicians it's not just fee for service like everyone else. They get billing based on prevention-based milestones as well, which I don't fully understand. That is a different way of billing. So trying to encourage that if they've taken on more patients or they can meet certain criteria with level of chronic disease, then the billing is geared towards.
Right, it's geared to chronic disease treatment. But it's also based on the community they serve and the population within that. So some of it's population driven plus patient driven. So you're right, the formula is a little hard to understand. But I think we're going to see innovative new ways of delivering these kinds of services. So,
well, at the risk of